Hello, my name is Colleen Cook. I am a born Trinidadian. At the age of 17, I went to the United States where I acquired a PharmD, and later on, I also became certified in diabetes education and care and management. And today, I am honored to be able to share some of my knowledge with you. So my goal today, my personal goal, is to be able to enhance and individualize diabetes care for my community members. So this is my way to give back to the community. And I have one little short story I want to tell you. My daughters were both in soccer, and I always remember the soccer coach saying, "You're only as strong as the weakest member on your team." So today, I hope to share my knowledge with you so that you will become more confident and you're able to manage your diabetes care and make our community stronger for it. So today, my topic is understanding diabetes. I called it the ABCs of diabetes care and management on purpose because I feel that there's quite a deficit in the education and background of all the diabetes patients, and I think we need to narrow that gap somehow, and I think today would be an opportunity for us to do that together. So my objectives today, I am going to review the diagnosis of diabetes. We're going to look at healthy living with diabetes. We're going to focus on carb counting, reading food labels, checking your blood glucose, understanding the difference between high and low blood glucose, how to treat low blood glucose, and also lastly, the management of sick days. So first, I want to compare diabetes in the USA as it is in Trinidad. As we know right now, we're really in an epidemic when it comes to diabetes, and it's something where we have to find a way to fight this disease and overcome it so that we could all be successful in how we manage our own diabetes. So according to the CDC, in the USA, there's 34 million people with diabetes. And of those, 1 in 10 have diabetes. And that's a lot of patients. And then within that 10, 1 in 5 don't even know they have diabetes. It is projected by the year 2050, 1 in 3 people will have diabetes. So it's pretty scary when you think of the numbers. Now, when I look at Trinidad, there's at least about 121,300 adults with diabetes right now, and it being a small country, that represents like 1 in 8 patients. So it could be your brother, your sister, your mom, your dad, and who knows, they don't even know they have diabetes. Now, if you look at the USA, you could parallel it to Trinidad. The COVID has totally expedited the prevalence of diabetes. And I have seen that because I have worked in a hospital for 25 plus years. And in the last 2 to 3 years, I would say 50% of my time is being spent trying to manage the diabetes in these COVID-induced hypoglycemia patients. So it definitely is representing a lot of challenges for us because with COVID, we know we can't go into the patient's room and talk to them. Everything has to be virtual or through a video, so it's really a little bit challenging to work with all these patients. So if you look at the diabetes trends in Trinidad and Tobago, if you look at mortality right now, in all-cause mortality, diabetes represents 14% of those deaths. So that is, again, astounding. And then if you look at the graph behind me, if you look at it, for men and women, it continues to grow. So we're already in the year 2021, and we're hitting 12.5%. It's going to continue to grow in that direction if we don't do something about it. And so that's why today we're going to do that by helping you get some background on how to treat diabetes. So what is diabetes? I know people assume people understand, but I'm going to just kind of just make it simple, but this way I want you to understand it a little bit more. So diabetes is a lifelong disease. It's caused by excess glucose or sugar that builds up in your blood. So think about it. Every time you eat, you're going to increase the glucose in your bloodstream. But if you don't have diabetes, your body will produce a hormone called insulin that will actually go in, it's released by your pancreas. It goes into your bloodstream and helps you helps you uptake the glucose to get energy. When your body doesn't have enough insulin or the insulin is not working efficiently, the glucose stays in your bloodstream and it continues to increase. So what happens then, the glucose causes complications for you if you don't do something to bring the glucose back down. And we will talk about this later. Right now, I'm just kind of giving you some facts about diabetes. So the complications we're looking at is complications to the eyes, the kidneys, the heart, and the nerves. So the key to success is for me to help you manage your blood glucose so that you can live a long, healthy life. So let's look at a diagnosis of diabetes. To be diagnosed with diabetes, you must meet one of three criteria. So the first one being, you need to have an A1C, which is a blood draw, that is greater than or equal to 6.5. We'll explain that later on, but these are just some facts. You have to have a fasting blood glucose greater than or equal to 126. So that means when you first get up in the morning, if we check the blood glucose of every single person in this room, your blood glucose should not be more than 126. There's something called a 2-hour oral glucose tolerance test, and that is done in the doctor's office. And that's another way for them to confirm that you do have diabetes. So even if your blood glucose might be, say, 130 one morning, that doesn't mean that you have diabetes. They have to have other criteria where you'd go into the lab, see a physician, and they will run some other tests. But if you do a random blood glucose and it's greater than or equal to 200, and it's accompanied by symptoms of like thirst, hunger, you keep wanting to go to the bathroom, that's usually a big sign that you may have diabetes. So let's look at the diabetes, the diagnosis a little bit closer. So let's focus on the A1C. So you might ask yourself, what is the A1C? The A1C is a lab draw that the physician will do in the office if you go in to visit and they're concerned that you may have diabetes. And what it is, it measures the glucose over 3 months. So even if you had a bad day where you went and you ate a ton of birthday cake, that's not going to make you diabetic for that day. They need to look at the last 3 months of your blood glucose, and they'll take an average of that, and that's what is reflected in the A1C. The glucose attaches to the hemoglobin, and that's what is measured to get you that A1C. So a normal person would have an A1C less than 5.7%. Somebody who is pre-diabetes will have an A1C of 5.7 to 6.4. And then somebody who is diabetic will have an A1C greater than or equal to 6.5. Okay, now we're going to look at, let's focus on the blood glucose alone. If you check your blood glucose first thing in the morning, and your blood glucose is less than 100, you're perfect. You do not have diabetes. If they check your blood glucose and it's between 100 and 125, that tells us you're starting to go into the pre-diabetic range. So at least that way you know, and you could do something about it. And then if your blood glucose is greater than or equal to 126 in the morning, that is a diagnosis of diabetes. See, let's talk about the oral glucose tolerance test. So think about it this way. You're going to go to the office, and if the doctor suspects that you may have diabetes, he will give you, it's a sugar drink. Okay, so you take that drink, and then the nurse or the doctor will measure your blood glucose like 2 hours before and 2 hours after you take that sweet drink. And here's some other criteria. So it will say a normal person should have a blood glucose less than 140. So that's the safe zone. If you're pre-diabetic, your oral glucose tolerance test will be 140 to 199. And then if you're diabetic, your oral glucose tolerance test will be greater than or equal to 200. Okay, so now I'm going to focus on two of the main types of diabetes. The first one being type 1. Type 1 represents 5 to 10% of the population of patients with diabetes. And then type 2 usually represents 90 to 95%. And I'm going to focus on these two types of diabetes. Of course, we have gestation diabetes, but we're not going to, for the purposes of this education today, I want to focus on the first two. Okay, so let's talk about type 1 diabetes. This happens when your immune system, the cells that produce insulin, is destroyed. It could be destroyed by a virus, it could be destroyed by COVID, it could be destroyed by a bacteria infection you got. We don't really know, but these patients, unfortunately, the pancreas, the beta cells in the pancreas do not produce any insulin, so they become insulin dependent. So the only way for those patients to survive is to have insulin. Now, it usually develops when you're a child or a young adult, although we're seeing more and more cases right now in the COVID population. And then the symptoms on presentation would be like, all of a sudden, excessive thirst. You keep going to the bathroom. Your appetite is affected. Your unexplained weight loss. And that's where a lot of people miss things. They think, oh, I lost 15 pounds over 1 month. Okay, that is not actually safe. You really should only lose maybe half to 1 pound a week, or even a month. I mean, some people, if you lose 10, 15, 20 pounds in 1 month, that's not a good sign. There's something going on and you need to address it. Now, type 2 diabetes is an impairment of the way that your body regulates and uses sugar as a fuel. So your pancreas produces insulin, but not enough. And because of that, you're not able to get the energy you need from the food that you eat. So you eat your food, the glucose rises in your bloodstream, insulin kicks in, the glucose is taken up by the cells, and you get energy. But if you don't have enough insulin, you're not getting, the glucose stays high, you get some energy, but not all. You feel a little bit fatigued because your body, the glucose is too high in your system. So some of the factors that affect type 2 diabetes would be being overweight. So if your BMI is greater than 25, that's a sign that you need to kind of watch it because you could eventually develop diabetes if you don't do something about it. If you're physically inactive, if you have a family history, meaning if you're first-degree relatives, so like your parent, your mom or your sister, your brother has diabetes, you are at a higher risk. We look at race and ethnicity. Blacks have more diabetes than Asians, who have more diabetes than Hispanics, who have more diabetes than white. So Trinidadians, you know, you're in, because of the ethnicity, you're already going to have that working against you. Anytime you have high blood pressure or high cholesterol, those are signs, those are factors that could affect and cause you to get type 2 diabetes. There's also something called polycystic ovary syndrome. That is a risk factor, as well as giving birth to a baby more than 9 pounds could also be a risk factor. So if you think about type 2 diabetes, think about it this way. I have this diagram here showing insulin represented as a key, and then we have an S for sugar for when you eat. So let's say you ate food and your body kicks out insulin. If you look at that diagram, you would see that sugar and insulin is in the bloodstream, but if there's too much sugar, the key cannot get to the lock, which is the insulin receptor. So think about it that way. You are preventing the insulin in your body from working efficiently because it cannot get to the receptor to work. Okay, so now we're going to look at nutrition. So good nutrition is very important when it comes to diabetes. It actually is the #1 treatment. People forget that. Before you go into drugs and insulin, really, you need to focus on nutrition first. So a healthy diet includes whole grains, vegetables and fruits, fat-free or low-fat milk and dairy products, lean meats, poultry, eggs and nuts are all good, beans and legumes, and foods low in saturated fats, trans fats, cholesterol, salt, and added sugars. So here are some healthy tips for eating. So foods with carbohydrate will, of course, raise your blood glucose. But so of course, like carbohydrate would be like you get it from breads, pasta, rice, cereal, fruit, potato, and yogurt. So those are kind of like the main foods that supply the carbohydrate. Now, somebody might say, well, what if I stop all the carbohydrate right now? Could I stop diabetes from happening? No, you cannot, because instead you will make a deficit in your body. So you want to get enough carbohydrate with every meal to provide you with the nutrients you need, but you don't want to have more than what the requirements are. And we will talk about that in more detail in the next point. So you might say, well, how much carbohydrate should I eat? So if you are a woman, you are allowed 45 to 60 grams of carbohydrate, and that is 3 to 4 carb choices. So think about it this way. Each carb choice is 15 grams. So you're going to have to learn to look at your food labels and try to estimate how many carbohydrates you're taking in at every meal. For men, because they're taller, they have more muscle, they are allowed to have 60 to 75 grams of carbohydrate, which is the same as 4 to 5 carb choices per meal. So, and then also with healthy eating, you want to stay consistent with your protein content. So I would say at every meal that you eat, you need to have protein, 3 to 4 ounces of protein. So think about it. We all play cards. So a deck of cards is about the size of your hand, right? That's the size of meat you need to supply 3 to 4 ounces of meat. So you don't need to have a big steak that's 12 ounces. Just 3 to 4 ounces gets you that serving. And then total fat, of course, you want to keep that. If your total calories per day is 2,000 calories, the fat should only be 25 to 35% of that 2,000 calorie daily diet. Okay, part of healthy eating, you need to manage your weight. So we talked about the BMI. So a healthy BMI, you need to have it between 18.5 and 24.9. So again, you need to kind of look at what you're eating when it comes to choose high fiber foods. Again, I'm going to stress vegetables, fruits, whole grain breads, and cereals. Physical activity. They usually recommend that you have 150 minutes of moderate physical activity per week. So, or you can do 75 minutes of vigorous exercise per week, but that will be split up into 3. So you're not going to just do 75 minutes in one day, okay? So if you think of 150 minutes per week, that's really only 30 minutes Monday to Friday. 5 times a week is all you probably need to stay healthy physically. And then you always want to check with your doctor if you decide. A lot of people, they get diagnosed with diabetes and they decide that day they're going to turn it around. So they're going to go and run 4 miles. No, you don't want to just suddenly start running 4 miles a day, because remember, diabetes is a slow, chronic disease. So if you went and ran 4 to 5 miles a day, you could actually have a heart attack or stroke, because you need to know what is your blood pressure. You need to go to a physician and they would give you the clearance to start exercising. You have to make sure there aren't any factors that could affect your heart, which is high blood pressure, high cholesterol, or being overweight. So today, one of the biggest things I want to have you remember leaving today is carbohydrate. Because the only way to combat diabetes is to understand the carbohydrate. Because remember, carbohydrate diabetes, they're linked, it's a bidirectional, okay? So one carbohydrate, I have it in red, is equal to a carb choice, which is equal to 15 grams of carbs. So I gave some examples of what represents 15 grams. One slice of bread, that's 15 grams. So if you're going to have breakfast, I really don't want you having 3 and 4 slices. Maybe you're allowed 1 to 2 slices. So that would be 15, 30 grams, if you think about it. A small apple or orange is a carb choice. A third cup of cooked rice or pasta. So again, if you look at the size of a cup, that represents 3 carb choices. So how many people eat 2 cups of rice? That would be 6 carb choices. Remember, I said women only allowed 3 to 4 carb choices a meal, so you would have already gone over your allowance for that meal. And same with men, 4 to 5 carb choices per meal. So I have it, I'm going to keep saying that because I want you to remember that. A half cup of fruit is a carb choice. A half cup of mashed potatoes is 1 carb choice. Legumes like kidney beans, lentils, a half cup is a carb choice. So it was eye-opening for me when I first started studying diabetes. I'm like, oh boy, I'm going to change the way I eat today because I didn't realize I can't just slam rice onto my plate. I need to look at what else I'm having with the rice. If I'm having meat, if I'm having legumes, oops, there's more carbs. If I'm going to have a slice of bread, more carbs. So you really, really need to look and count the number of carbs you're eating. It doesn't mean you're a fanatic. It means that you're being smart and trying to be more of a healthy eater. Okay, so what I did is I went into the Naparima cookbook that I think almost every Trinidadian has or owns, and I pulled out a few of the staple foods that I know people are eating. So, the famous doubles. And I have a picture here showing the doubles with a bunch of chana in the middle. That doubles represents 45 grams of carbs. So, because the top of the doubles is 1, the bottom is the second carb, the chana is the third carb. So, I hope today that everybody in this room will decide to have only 1 doubles when they buy doubles and not have 2 or 3. So, because I would recommend instead, if you want to have your doubles, you might have to have a piece of chicken breast with it because you can't have 2 doubles or 3 doubles. You're overwhelming your system with sugar. Okay, so now we're going to look at sada roti. So I want you to focus on the nutritional facts that I have on this slide. So serving size, 110 grams. So you need to weigh out what 110 grams is. The number of calories per serving is 230. And then look at the carbohydrate for that 1 serving, 48.4 grams, which is, again, roughly 3.2 carb choices. Now, I don't make sada roti, so I know it depends on how big, some people make thin ones or thicker ones, but you need to weigh it so you kind of get an idea of what 110 grams reflects. But again, did you see that? So if it's 40, that's like 3 carb choices. And again, women are only allowed 3 to 4 carb choices a meal, men 4 to 5. So you can't be having 4 and 5 pieces of sada roti at every meal. Okay, let's look at pizza. So everybody here, loves to have pizza 2 to 3 times a week, maybe for some people. So again, you need to look at the nutrition facts. So this is why I pulled this all from the Naparima cookbook. So if you look at this, serving size is 162 grams. This is probably a slice of pizza. Number of calories, 384. And carbohydrate, 34.8 grams. So if you think about it, a healthy slice, is probably a big slice, deep dish probably. That's about a little bit over 2 carb choices. So how many people stop at 2? Many people have 3/4 of the pizza. So again, I'm not trying to make fun of it, but I want you to be aware of what you need to be doing when you look at carb counting and trying to learn to be an estimator. That's the only way for you to do better with your diabetes. So now we look at chicken puffs. Same thing, nutritional facts. Serving size, 53 grams. I'm thinking it's probably one puff. Depends again on the size. Calories, 131. Carbohydrate is only 6.8 grams. They might be like, oh, how come? Well, because again, carbohydrates come from flour products. It's usually, you have eggs and butter in that. So you have to, that's probably why the carbs is so low, but the calories might be high. So you have to kind of look at both parts of that label to understand it. And lastly, I'm going to look at corn pastels for Christmas, And actually, this one actually is a good choice for people because the serving size is 86 grams, but the number of calories is only 129, but the carbs is 11.9 grams. So one corn pastel is pretty healthy, I think. It's only not even 15 grams. It's less than a carb choice. So you could have that with your other delicacies. Okay, so some people ask me, blood glucose monitoring, why is that important? It's very important because how would you know if the medication that your physician gave you is the right dose for you? For example, if you're put on a drug called metformin, I know most of you are familiar with it, and you start off at 500 milligrams twice a day. If you never check your blood glucose, how would the physician know if it's the right dose? So again, if you are on certain medications, you should ask your physician, how many times a day should I check my blood glucose? Usually it's anywhere from 1 up to probably 8 to 10 times. But most people 1 to 4 times a day is usually ideal. But again, it depends on whether you're only on oral medications or insulin. So the goals, if you are less than 65, we need to have your morning blood glucose be between 80 and 130. Before lunch, before dinner, same thing, between 80 and 130. But if you choose to check your blood glucose 1 to 2 hours after you eat, which is still an okay option, you need to be less than 180. So either way, you need to really look at your blood glucose. Now, when you're over 65 years old, we do allow a little bit more conservative, so we allow you to have a blood glucose range of 90 to 150, and then before meals, less than 200. So we can allow you to have a little bit more, less than 200, 1 to 2 hours after. So again, as you get to be over 65, you might be a little bit more lenient. And this table just kind of summarizes everything for you. So I can skip over this one. All it's again showing is the blood glucose range. Don't forget, fasting means your morning blood glucose. And then the modified for the elderly. So you can look at this at your convenience, but the only one thing I want to stress is that the A1C needs to be less than 7. For most of you in this room, unless you're over 65, we probably would allow you to allow A1C less than 8. But I would focus on less than 7. So people can question like the blood glucose. What if I check it? What does it mean? So if in the morning you check your blood glucose and it's like 120, that's good. You check before lunch, it's 100, you're good. All of a sudden, before dinner, you're 250. Okay, think about the meal before. What did I have for lunch? Because when you check a blood glucose before meal, it's affected by what you ate with the meal before. So if your dinner is high, it means you ate too much for lunch. If your lunch is high, you ate too much for breakfast. So that's basically how you try to understand the blood glucose numbers. If your blood glucose is more than 240 all day, that's a situation where you need to call your doctor because there's something going on. Something as easy as maybe you're getting an infection. It tells you if your blood glucose starts to go up, if you weren't eating badly, maybe you're getting sick. So it kind of tells you something. So that's why almost diabetes is almost like problem solving. And that's why I'm trying to give you the tools to help you problem solve and be able to manage your diabetes better. If your blood glucose is less than 70, 2 to 3 times a week, okay, Now we're over-treating you, we're over-aggressive, and we don't want that. Because if your glucose gets too low, you can have a lot of accidents, you could fall, you could get in an accident driving because you lose consciousness. So really, below 70 is not okay. We're going to talk about that in a few slides later on. And if you're a type 1 diabetic patient, if your glucose is like 400, you might want to check your ketones, your urine ketones, because maybe you might be getting into something called DKA. But for the purposes of today, we're not going to talk about that. That's for later on when you understand your diabetes a little bit better. And of course, you would call 911 if you were with your loved one and the person does not want to get up and they're diabetic and you cannot wake them up. You definitely want to call 911 because maybe their glucose is less than 50. We don't know until you check it. But being unconscious is not an okay thing. So that's an emergency situation. So the symptoms of high blood glucose. So say you're not diabetic yet, but you notice all of a sudden the last few weeks you've been extremely thirsty. You keep going to the bathroom to urinate. You have a hunger, you're irritable, unexplained weight loss, like I was telling you earlier, 10, 15 pounds in like a month, blurred vision, you realize your legs are getting in, you have infections in your skin looks bad. You know what, those are signs that you might be becoming diabetic. So you definitely want to get some medical advice and go see a physician. Now this is the one I want to focus on. So if you look at this slide, low glucose. So that's something anybody on insulin needs to understand. Hypoglycemia, also known as low blood glucose. The symptoms, if you look at the character here, you see the person shaking, you're dizzy, lightheaded, you're anxious, you're nervous, your heart is beating, you're hungry, you're numb, you might even have visual problems. It could be that you have clammy skin. It could be that your glucose is low, so you want to check your glucose at that point to make sure that you know, again, problem solving. You're trying to figure out what is causing me to have these symptoms. So what are the risk factors for low blood glucose? Insulin, number one, right? You put on insulin, if you overtreat, and we're going to talk about this, you need to make sure you understand how to take your insulin and how to coordinate it with your meals. Otherwise, you could have low glucose. Certain drugs like clomipiride, or you might be familiar with Amaryl, something called glipizide, I'm not so sure what the names are in Trinidad, but you need to look up generic names because that's what I know, because every country has different brand names. The older you are, and the duration of diabetes, because as you get older, your requirements for insulin may actually decrease for some people, and so somebody who's 85 will not need the same insulin as somebody who's 32. So you need to that's why you need to always be checking your blood glucose, because things do change as you get older. Nutrition, the timing of the meals will make a difference. Exercise, alcohol ingestion. If you drink too much alcohol and you don't have any carbohydrate with it, you could get low glucose. Kidney disease, as you get older, your kidney function will start to deteriorate, and it's evidence-based, it happens, so it's not like I'm making this up. With diabetes, it's progressive. Most people end up with some kidney failure, and that will affect the insulin needs that your body needs. Liver dysfunction is a big one. And then if you have a history of unawareness, after being diabetic for 10, 15, 20 years, people don't even know they're low. They're so used to being low, they don't even know. And that's the most dangerous type of hypoglycemia, because when you suddenly are low, you could get unconscious really quickly. You could lose, or you could have a seizure. Some people even died from low glucose. So again, I can't stress blood glucose monitoring. That's the one way to keep track of your diabetes. So how do you treat low blood glucose? So say you check your blood glucose using a glucometer and a finger stick, and your blood glucose is less than 70. You need treatment. So what I'd want you to do, sit down, If somebody's around, tell them, I'm really low, I'm clammy, I'm not feeling well. Maybe that person could go grab you a half cup of juice or soda or four glucose tablets. You drink the half cup of juice in one, just drink it all, wait 15 minutes, and check your glucose again to make sure that you got towards 100. Very important. If your glucose gets below 50, that's considered severe hypoglycemia, and that's where things could happen very quickly. You could become unconscious like within minutes. So what I usually tell people to do, you have to double what you did before. A full cup of juice or regular soda, you have to drink the whole cup down and wait 15 minutes and recheck your blood glucose. 8 glucose tablets does the same thing. So I'm not so sure what you can buy here, but most people tend to have juice or soda at home. So that's what a lot of people use. But if you're at the beach or somewhere where you don't have access to juice or soda right away and you're away from people, you should have glucose tablets with you then. You need to have something with you everywhere, be it in your house, in your bathroom, at work. You need to have it in case you have hypoglycemia. So I have this highlighted in red. Severe hypoglycemia can lead to falls, seizures, coma, and even death. Because I want to emphasize that low glucose is could be really tragic. And this is a 15-15 rule that I have learned to use when I educate people. If you think about it, if your glucose is between 55 and 69, you want to do 15 grams of carbs. And I showed you an example of what 15 grams of carbs is. 15 grams of carbs and check your glucose in 15 minutes. So if you think that way, you could successfully treat your low glucose. And here I have some sources of what represents 15 grams of carbohydrate. It'd be 4 glucose tablets, 6 pieces of hard chewable candy, 4 ounces of fruit juice, which is the same as half a cup, a tube of glucose gel, or 1 cup of skim milk. So different options. And what are the complications of diabetes? So if you did not check your blood glucose, how would the physician ever know that you're getting high, right? So say your glucose starts to run 300, 350, and it keeps going up high, you could end up with eye damage, retinopathy, kidney damage, nephropathy, nerve damage, neuropathy. Those are the big 3. But then you could end up with heart disease, which is like heart attacks, foot damage, and skin conditions. So sick days. So sick days are really important. Remember I told you earlier, if your glucose starts to trend up and you don't know why it's happening, you were eating, you're following your diet and everything perfectly, maybe you have a urinary tract infection or a bladder infection, or maybe you have the flu is coming on, or maybe you got exposed to COVID. I mean, just because we're in that pandemic right now, those would be signs that something is going on. So you definitely want to follow up. So what I would do is keep hydrating with plenty of water and try to eat simple sugars and check your glucose 3, 4, 5, 6 times, maybe every 3 hours, just to make sure that your glucose is not more than 240. And if you start having vomiting and diarrhea, of course, those are signs that you're really not doing well. So I am done with my presentation today. So I hope you learned something, and I hope you took something away with you today. So I'm going to open it up to some questions from the parishioners, and I will have Therese start with the questions.
And yes, we at OLPH, we have some questions that the parishioners sent to us via email, and I would like to ask you for your responses to them. The first question would be, when you mention 3 to 4 carb choices, is that per day?
No, that is 3 to 4 carb choices per meal if you are a woman, or 4 to 5 carb choices if you are male.
My second question is, can I skip carbohydrates totally?
No. I mean, if you are on insulin, especially, you can never skip your carbohydrate because you will get a low glucose. But if you're probably in the very beginning of the diabetes diagnosis, you could probably start with lower carbs, like maybe 1 to 2 carb choices a meal if you're trying to lose weight, but you can never skip it because then you will have zero energy and your nutrients will really go down for your body and your brain. So you need some carbohydrate for just normal daily function.
How do I store insulin?
Okay, that's a really good question. Normally, I would say an insulin vial or pen is good at room temperature for 28 days. Otherwise, it should be kept refrigerated. But because of the tropics and how hot it is, and some people do not have air conditioning in their houses, I would recommend keeping it in the refrigerator.
What is the difference between 70 to 30 insulin and Basalga?
Basaglar. Okay, now this is really, really important. I do know that the insulin, the 70-30, is the one that's free for, I think the country provides that free for people with diabetes. But that one takes a lot of coordination with meals. So 70-30 means it contains 70% long-acting and 30% short-acting. So if you're going to take this insulin, you're going to take it twice a day, 1 dose with breakfast, and the second dose with dinner. We usually recommend 15 to 30 minutes before the meal. So if you did not eat dinner, you do not take your dinner dose. You can't, it has to be you have to eat 3 meals a day for the 70-30 insulin to work. The Basaglar is the generic for Lantus, and that's a once-a-day insulin. And actually, that one is not coordinated with meals. You take it once a day, either morning or bedtime, and you would still take it whether you ate or not.
Can I get off of insulin?
I would say no. I know a lot of people get really, really confused. They think because I am insulin, I am my diabetes is terrible, but that's really not true. A lot of people, remember I talked about it being a progressive disease. At some point, if you, in your life, maybe 40 years down the line, you might have to go on a small dose of insulin, and it's not something that you might be able to stop because, remember, it's progressive, so your pancreas is producing less and less and less insulin with time. So you will probably always be on a small dose. You might be able to affect the number of units by eating better, but you may not be able to totally stop the insulin necessarily. So it would take a lot of diet and exercise to do that.
What can I do if my blood glucose is 300?
Okay, so if your blood glucose is 300, that's a very good question. I want to tell you all today, do not react to one glucose number, okay? You have to look at the blood glucose over 1 to 2 days. So what if you were perfect, you ate a big piece of cheesecake, so your next glucose is 300. What I would do is, you know what, I would kind of say, okay, I ate that, let me see what I am. You could check your glucose 2 to 3 hours after and see if it's starting to decrease.
Why do I need to check my blood glucose?
Okay. Checking your blood glucose allows you to manage your own diabetes. So by checking it, you know if you're meeting your goals. Remember I told you the goals is to have your pre-meal glucose between 80 and 130 for a young person, less than 65. So how would you know if you're meeting your goals? So it's very important that you find out from your doctor how many times a day that they would like you to check your blood glucose and what are your goals.
How can I prevent getting diabetes?
Okay, so I would say you need to go have your physical every 1 to 2 years, because remember I mentioned that diabetes is a growing epidemic. So for us to know, we would have to have them check a A1C at that doctor's visit, or they might do a random blood glucose level when you get there. But another way is for you to look for any signs that tells you that there may be a chance that your having symptoms related to diabetes. And you can go back into the slides, but mostly stuff like the thirst, the urination, the hunger, the irritability, the blurred vision, those type of symptoms.
My grandmother is diabetic. Can I get it?
You can, because I mentioned that one of the risk factors is but I did say a first-degree relative, but it doesn't mean that you can't get it. If your grandmother has it, what if your dad or mom has it and they don't know? Because remember I told you that people don't even know they have it. So I would say you have a chance, or what you want to do again is do your routine physical checks, which are, every 1 to 2 years, and have the doctor check your blood glucose or your A1C, so you know if you're pre-diabetic.
If I am on insulin, can I eat whatever I want?
No. So insulin is very interesting. The more you eat, the more carbohydrates you eat, the higher your glucose rises in your bloodstream. So if you're not diabetic, you might be okay. But if you continue to eat that way, you probably could push yourself into diabetes. But if you're diabetic, you can't just keep taking more and more insulin to take care of the glucose that you took in, because what will happen, more insulin means weight gain. The more insulin you eat, that means you're eating more and more, you're obviously gaining weight, and you need more and more insulin because you're overwhelming your body. So you really need to watch what you eat at all. For the rest, we all should do it because it's healthy living.
If I missed my insulin dose, what can I do?
That is a good question. So it depends on the type of insulin that you're on. So if you are on the long-acting insulin, that's once a day. If you forgot to take it and it's like 4 hours after, you just take it when you remember. But if it's a 70-30 insulin, you can't take it. If it's an hour after you ate, you can't, because then you run the risk of getting a low glucose. So what I would do is probably check your glucose more often for the rest of that day, and the next time for dinner, you take your second dose of 70-30 insulin. So it depends on the type of insulin you're on, whether you're allowed to take it or not.
Okay, and one last question, which is a personal question. What or when is the best time of day to take insulin?
Okay, so again, that comes down to the type of insulin that you're on again. But say you work a night shift. Your hours are going to be different. Because normally, the long-acting insulin, basic GLAR is what it's called. You take it either morning or bedtime. But if you are working from, say, 9 p.m. to 7 a.m., your routine is different. So maybe you would take your insulin at 8 p.m. before you go to work, the long-acting one. And then every time you eat your meal, if you are on a short-acting insulin, you would take the short-acting insulin with your meals. So don't take it at 5 o'clock when you're eating at 8 o'clock. It has the short-acting insulin is always around a meal.
Thank you,
Okay.
Mrs. Colleen Cook.
And thank you again for having me, allowing me the opportunity to try to educate you. I did, at the end of my presentation, I do have some resources that you can use to help you learn how to eat better. And then I do have references, and of course, I'm from the USA, so I do have the American Diabetic Association and the Association of Clinical Endocrinologists and American College of Endocrinology. But actually, they're very good resources if you want to learn more about diabetes, because today, I only touched the surface. I gave you what we call survival skills, the basics of what you need to know. We need to have everybody start with a foundation. From here on, I would say you will need follow-up education, and that could involve a one-on-one session with your dietitian or with your primary care physician. But I'm telling you, you will need some type of education as life goes on with diabetes, because it's chronic, and you're going to end up increasing medications, and you'd have to understand how to eat, how to check your blood glucose. And so I really, really want you to follow up.
On behalf of Our Lady of Perpetual Help, it is a pleasure that you were able to fly down from the United States at such short notice to give us this workshop, this program, which is going to help save so many lives. But we also want to note that in November 2021, the Ministry of Health, they did announce that because of the epidemic of diabetes and becoming one of the high death causes, they made actually December Diabetes Month. So as soon as we found that information, we were able to share it with our vicar, who was able to allow us to even have this workshop, to even have this program aired, because we want our parishioners to have a healthy lifestyle. We want to be able, during this time of synodality being a time when we're all walking together on a journey, hoping that at the end of this earthly world, we will see Jesus Christ before we enter into heaven. This is synodality 2021 to 2023. So we take this opportunity to share this information with all our parishioners, to share with everyone walking with us on this journey. So we really wish to thank you for giving us this information, which we can now share, and it will actually be able to make an impact on the quality of people's lives, which will affect us now and many years to come. So we want to thank you for this opportunity. Even following from the Ministry of Health, we are in an epidemic, both with COVID and diabetes, and together it's even like double fatal. So with this information, a heartfelt gratitude for you being able to have this workshop with us, and to our vicar from Our Lady of Perpetual Help to allow this to be able to be given out and shared to so many people. So thank you very much.
Okay, and thank you.
I just have one important question for you. I know that you spoke about going to one's own dietitian and medical doctor. I know that you are in the United States, but can we contact you virtually? Can someone reach out to you virtually for help?
Of course. I want you to know that I have a passion for diabetes. I love helping my fellow parishioners, and so that's one of the things one of the reasons why I was excited about giving this talk, is that it would allow me an opportunity to do a one-on-one consultation with anybody who's interested in improving their diabetes care. So yes, I would gladly accept any opportunity to work with parishioners.
Again, thank you very much, and may God bless you with every success, and may we all experience His great blessing of health and prosperity in this new year. Thank you very much.
Okay. Thank you, Father.